is Datrielle Bailey, and today we will be discussing coronary artery disease and the detrimental effects. Let's begin by discussing what coronary artery disease is. Coronary artery disease are pathological changes which occur within the artery walls. These changes diminish blood flow through the vessels. Coronary artery disease causes the coronary blood flow to be insufficient during physical exertion or in stressful situations. 50% of all deaths worldwide are said to be caused by coronary artery disease. Coronary artery disease can lead to other conditions such as myocardial ischemia or even heart attacks. This disease leads to this condition by profound vascular spasm of the coronary arteries, formation of atherosclerotic plaques, or thromboembolism. Let's take a moment to discuss each of these mechanisms. Vascular spasms are abnormal spastic constriction that narrow the coronary arteries. Vascular spasms occur when platelet activating factors are released from the endothelium that fuse to underlying vascular smooth muscles, causing it to contract. Vascular spasms are triggered by exposure to cold, physical exertion, and anxiety. Vascular spasms are reversible. Now, let's focus our attention on atherosclerosis. Atherosclerosis is an arterial disease that leads to the occlusion of affected vessels and reduces blood flow to them. When an atherosclerotic plaque forms, it bulges into the vessel lumen. Although it is still unknown exactly what causes atherosclerosis, there are a series of events that are thought to lead to this condition. This condition begins with injury to the wall of the blood vessel. This injury then triggers an inflammatory response that begins the process of plaque buildup. The inflammatory response can be triggered by oxidized cholesterol, high blood pressure, bacteria, or viruses. High risk factors are often associated with atherosclerosis and coronary artery disease. These risk factors include genetic predisposition, obesity, smoking, hypertension, or elevated cholesterol levels, among other things. Atherosclerosis attacks several arteries throughout the body. This attack leads to damages within the vessels of the heart and the brain. Now that we have discussed the other two mechanisms, let's now discuss thromboembolism. With thromboembolism, the enlarging atherosclerotic plaque can rupture or break the endothelial lining. This can lead to clot formation. When the clot attaches to a vessel wall, it is known as a thrombus. The thrombus can enlarge and completely block the vessel at that site. A free-floating clot can then plug a smaller vessel. Atherosclerosis can result in a gradual or sudden occlusion of a vessel through thromboembolism. There was a study conducted to evaluate whether or not beta blockers are useful in reducing the risk of major adverse cardiovascular events in patients with stable coronary artery disease without prior myocardial infarction or left ventricle dysfunction. Beta blockers play a significant role in coronary artery disease pharmacotherapy. But the question has been raised of whether or not these medications are useful in individuals with coronary artery disease who have no history of myocardial infarction or left ventricular dysfunction. In this study, 2 researchers reviewed sites such as PubMed and Google Scholar. From these sites, these researchers examined studies that were published until March 2021 that compared the effect of beta blocker therapy, beta blocker treatment, and placebos on major adverse cardiovascular events in patients with a history of stable coronary artery disease. The researchers also reviewed studies on composite adverse cardiovascular events, myocardial infarction, and cardiovascular death. The research primarily focused on the effects of beta blocker therapy on the long-term risk of major adverse cardiovascular events, myocardial infarction, and cardiovascular death. After a thorough literature search, selection, and review, 8,797 articles were retrieved by the researchers. Of the articles retrieved, 6 articles were used for observational study. Within these studies, data from 774,089 patients with a history of stable coronary artery disease were analyzed. The average age of the participants were 66 years old, and 64% of the participants were male. The results of the research determined that beta blockers did not reduce the risk of major adverse cardiovascular events, myocardial infarction, or cardiovascular death. There was no significant difference between individuals within the control group and the participants on beta blockers. Age, beta blocker prescription rates, and current smoking were predictors of major adverse cardiovascular events. Male gender and beta blocker prescription rate were predictors of myocardial infarction. There was no predictor for cardiovascular death. There are many detrimental effects of coronary artery disease. This disease can lead to complications such as chest pain, heart attack, heart failure, or an abnormal heart rhythm. Chest pain is due to the narrowing of coronary arteries, causing the heart to not receive enough blood. A heart attack is due to cholesterol plaque rupturing, blood clots forming, leading to a complete blockage of the heart artery. Heart failure is due to areas of the heart being deprived of oxygen and nutrients due to reduced blood flow. Abnormal heart rhythm is due to inadequate blood supply to the heart. Thankfully, there are treatment options for coronary artery disease. These options include lifestyle changes, such as exercising regularly or reducing stress, drugs, such as aspirin or beta blockers, or procedures to restore and improve blood flow. These procedures include angioplasty, stent placement, or coronary artery bypass surgery. In this presentation, we discussed coronary artery disease and its detrimental effects. We begin by discussing what coronary artery disease is. We continued on by discussing the mechanisms of the disease that lead to other conditions. Once discussing the mechanisms, we discussed a study that was conducted to evaluate whether or not beta blockers are useful in reducing the risk of major adverse cardiovascular events in patients with stable coronary artery disease who had no prior myocardial infarction or left ventricular dysfunction. After discussing this study, we discussed the detrimental effects of coronary disease and the treatment options. Thank you.